Your blood work shows high ferritin but normal iron, and your doctor says everything's fine. But here's what they're missing that could be making you sick. I'm going to show you how I helped a patient with high ferritin over 600 but normal iron reduce his ferritin to 142 by figuring out the root causes and then providing the appropriate solutions. My name is Dr. Thomas Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of the FreeDiet. And if you find this information helpful, please like and subscribe so more people can see this video. So I saw a patient, a 54-year-old man, who came in with fatigue, brain fog, joint pain, hair loss, insomnia, and gut symptoms. He was diagnosed with autoimmune alopecia areata and wanted help with all these issues. His labs came back showing he had high ferritin of 602, normal iron and saturation. He was negative for hemochromatosis. He had high ANA, thyroid antibodies, which indicated Hashimoto's, high inflammatory markers, high liver enzymes. So the first thing you want to do if you have high ferritin is get the proper testing, and the minimum you need to find out what's causing it is an iron panel, which includes serum iron, percent saturation, TIBC, and ferritin, CBC, chemistry panel, CRP, GGT, LDH, lipids, TSH, free T3, free T4, uric acid, insulin, and A1C. That would be the bare minimum, and this way you could start to figure out which of the multiple causes of high ferritin are at play. So most people think, oh, you have high ferritin, just go out and donate blood. Well, there's more to it than that. There's actually 7 main causes of high ferritin. I call it the 5 I's: liver disease, alcohol use, insulin resistance, the most common cause of high ferritin, inflammation, infection, illness, and iron overload. So out of those 7 causes, he had liver dysfunction, high liver enzymes, his inflammation markers were high. Under infection, testing indicated he had bacteria and yeast overgrowth, as well as reactivated Epstein-Barr virus. And illness, he had very high ANA, which is an autoimmune marker, besides his Hashimoto's antibodies. So I put him on an anti-inflammatory diet and the proper supplements, which I'll go over shortly. And over the next 3 months, his ANA autoimmune marker dropped to normal, as did his inflammatory markers, TSH, liver enzymes. He had more energy, sleeping better, he had less pain, his gut symptoms were better, and his hair loss had stopped. His ferritin was almost 50% down, and at 11 months, his ferritin was 142, and he continued to feel better, which included his pain clearing up. So how he achieved this was, 1, with diet. I put him on the FreeDiet, which is a diet I came up with years ago when I was dealing with my own autoimmune Hashimoto's and rheumatoid condition, IBS, fatigue, skin, and other health issues. With this, I was able to get better, and it's a diet that's free of not only gluten, but gluten, grain, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, gut, thyroid, and other chronic health issues. If you'd like a copy of phase 1 of the FreeDiet, we'd be happy to send that to you, and I'll put a link below for that. And I recommended the following supplements. First, the Functional 5, which is multi-fish oil, vitamin D with K, magnesium probiotic, curcumin with resveratrol and quercetin for inflammation support, gut supportive supplements, and other nutrients he was deficient in, along with adrenal and thyroid support. And a common question I get is, do I have to donate blood all the time with high ferritin? And the answer is, it depends what's causing it. With iron overload, absolutely it can be helpful. This patient didn't have iron overload, but when I looked at his other markers, his hemoglobin and his red blood count were on the higher end of normal, so donating blood in this case could be helpful. So I had him donate twice in the period of a year, which in turn was helpful even though he didn't have hemochromatosis or iron overload. And he may not have to do it again. So it is important to get regular follow-up testing if you're dealing with high ferritin to make sure you get it to optimal levels and keep it that way. So in summary, if you're dealing with gut, thyroid, or other chronic health issues, it's important to get the proper testing first, because if you find out the root causes and are provided the right solutions, I believe almost anyone can get better. Thanks for joining me today. I'll put a video that goes into the FreeDiet in more detail here, the FreeDiet phase 1 food chart below. Feel free to like and subscribe so more people can see this video, and I'll see you next time.